gentlemen, shall we rise to our feet as we welcome the Vice President, His Excellency, Dr. Bawumia. Please. Here comes the second gentleman of the land. He's going to exchange greetings with... You're welcome, sir. He'll exchange greetings with the dignitaries before he takes his seat. Indeed, Ghana is blessed with a vice president who is so intelligent when it comes to technology. He is a brain behind all these technologies we are experiencing in this country. Thank you, Your Excellency, Dr. Bawumia. Right, the Vice President is taking his seat. Ladies and gentlemen, let's still be on our feet as we sing the national anthem. Let's have the national anthem, please.
Management system, popularly known as the LIMS, a singular electronic records, medical records system that has several and numerous benefits to the health sector. The Lightwave Health Information Management System has been deployed in 466 of Ghana Health Service facilities as of 25th of October 2024. We currently have another 68 facilities undergoing the networking phase of the deployment and shall soon complete all process and go live. It is, however, heartwarming to say that all our regional hospitals, that's the 9 of them, 240 district hospitals, 61 polyclinics and 141 health centers are currently live on LIMS and of course can seamlessly refer cases to and from our hospitals, including the teaching hospitals, which indeed were the first to have been deployed. We have seen the many benefits of the use of LIMS, and we have clinical, operational, technical, and economic benefits as well as benefits to the citizens of Ghana and the government and more. And as enumerated by the CEO, Korle Teaching Hospital, these are benefits that affect all of us. What are some of the clinical benefits of the use of the LIMS? It has improved continuity of care, access to comprehensive patient history. It has also enhanced diagnosis and treatment, even as accurate and up-to-date information. It has reduced medical errors. It has minimized the duplication of tests and medications. It will also have better disease surveillance, early detection, and real-time tracking of outbreaks of diseases in the country. So, Your Excellency, what are some of the operational benefits of LIMS? It has helped us streamline our workflow, efficient data management. It has reduced administrative burden. Most of the services are automated now. It has improved patient engagement and secure access to their records. We also have better resource allocation because it's data-driven in decision-making. The economic benefits, Your Excellency, includes the cost savings. We have reduced paperwork, has improved efficiency. It has improved our revenue cycle management, including accurate billing. It has improved revenue generation at health centers as leakages are now significantly blocked. What is the population benefit of this system? It also has improved public health surveillance in real-time disease tracking. It has enhanced epidemiological research, access to comprehensive data, and better health policy development. These are all data-driven decisions. As we say now on our dashboard, we are able to see cases that they spring up. If we see too many diarrhea coming from different facilities, we know in that enclave there must be a problem and allow us to respond much quicker. What has been some of the technical benefits, sir? Your Excellency? It has a uniform data format. It is centralized data protection, so it's secure. It's scalable, it's easy to expand to other places, even when the hospital expands, and it is flexible. It's adaptable to change in healthcare needs. On the issue of governance, it has improved healthcare governance, data-driven decision-making. It has enhanced policy development, which is also evidence-based, improved accountability, better resource allocation, and improved international cooperation because we have reliable data to share. On the area of early detection and real-time tracking, the tracking of epidemic-prone conditions, as said earlier by Eric, through routine surveillance reporting and alerts being displayed on our dashboard allow us for early detection of outbreaks. Automaticity of the displays on the displays of the dashboard enhances detection and reporting of outbreaks. Your Excellency, we at the GHS have experienced all the advantages or gains LIMS offer, and I'm very happy that we have this opportunity. It was used during the COVID-19 though it was limited in scope. The current outbreak also has been visualized across as we go to our systems. God bless you. God bless you.
Thank you very much, Mr. MC. I'll talk to acting CEO. We'll do something about your position. CEO, let's talk after the program. Your Excellency, our cherished Vice President, Dr. Mahmoud Bawumia, the Chief Director of the Ministry of Health, and all other directors, Director General of the Ghana Health Service, other heads of agencies, health sector development partners, friends from the media, our cherished Korle staff, clinical and non-clinical. I see some of our nursing students also here, our friends from the media, my brother and friend, PC for Ablekuma South. Honorable Teacher Ago, distinguished guests, my brother Samson Jabba and the Lightwave team, invited guests, ladies and gentlemen. Your Excellency, it is my absolute pleasure to be here with you to commission this transformative project, the Lightwave Health Information Management System. There was a time, not too long ago, when if you wanted to find a patient's records, sometimes you even needed a flashlight. You needed a good map. You needed to be very tall so that you can look at corners, so you could find a folder for a patient that needed medical attention. Your Excellency, it was like playing hide and seek with paperwork. And if you are lucky and you find the record, sometimes understanding or deciphering the handwriting of the physician is another challenge. But today, we are all here to say goodbye to those days of the folder. We are saying goodbye to the folder era. Your Excellency, we are entering the era of data, the era of digital transformation. Your Excellency, using folders was always a reminder that we were about 40 years behind the rest of the world. And why do I say 40 years? If you go to the UK or any developed country, they also used folders some years back. Korle was built in 1923, almost 100 years ago. When we were using the folder then, the British were also using the folder. But in the early 80s, they let go of the folder. We held on to the folder until you and your boss came around. Yes. And we are happy that the folder era is gone. But Your Excellency, as a practitioner, I just want to be very down to earth and mention some of the serious problems we had with this system of waiting for a book before you see a patient. One of the sources of trouble or infection in hospitals is nosocomial infections, hospital-acquired infections. And one of the routes or vehicles for transmitting infection from one. So the folder itself was a problem. It was an agent of infection transmission. And we are happy that we have digitized and moved away from this age-old transmission vehicle. We thank you, Your Excellency, for inspiring this transformation drive. Your Excellency, apart from the infection, folders were also unfortunately tools for extortion. If you've been in a district hospital or regional hospital before, some people come, they are in a hurry, they are very sick. And so sometimes, it's not all the time. Some, if they say mensa woman. Some very wild, I call them wild people, sometimes they are not even hospital workers, they are around the hospital records. They can tell you if you have some money, they can get your folder right now. And so, ordinary Ghanaians sometimes are taken through a lot of frustration just for them to get their folder and for the doctor to see them. We want this country to develop, but these are the little things that tell us that we too, we day in this world, we've also come of age. Your Excellency, I watched TV some few years ago. I will not mention the station. And a journalist was saying that his dream is that Ghana will get to the place where when you go to a hospital, they will not wait for a folder. They will just type on a laptop or computer and then all your details show. And I called into the station and told them, you don't have to go far. Come to Korle here. It is happening. And the journalist was shocked. And so I'm very happy that we are here to let the world know that we might have a few challenges, but there's a lot that as a family we have achieved in Korle and beyond. Your Excellency, your leadership has made it possible for us to take healthcare into the digital age. You saw the need to bring healthcare services up to speed. And instead of just tweaking things here and there, you said, let's give this thing a serious upgrade. Your Excellency, not a reset, a very serious upgrade. And that's what we are doing here. We are here to give the system an upgrade. LIMS is going everywhere. We are not just talking about hospitals in big cities. Every district hospital now in this country has been connected to the LIMS or light wave system. And because of this, we have seen an improvement in many areas. Your Excellency, We are talking about 21 million individuals. 21 million Ghanaians now have their data captured in the LIMS system. Almost half of the population. 62% of the country is covered on this system. And we are working hard to make sure that the coverage becomes 100%. Your Excellency, there are many advantages. I will not bore all of you with advantages. But one very important advantage is that you cannot mix two individuals because their names look similar. Your Excellency, there are many Kwabena Jemfis in this country. And the reason why sometimes you hear in the news that they cut, I don't want to use medical terms, they cut someone's leg through surgery when it was not supposed to be the person, is that possibly their name looked just like someone else. But with electronic records, no two records are the same. No matter how close the names are or how similar the individuals look. And these are some of the very important advantages of going electronic with our records system. Yes. Your Excellency, it also helps physicians or medical staff.
Speak to us. You're welcome, Your Excellency. Thank you.
Thank you very much. Please take your seats. Thank you. Yeah. Thank you very much. Thank you. The Honorable. Thank you very much. The Honorable Minister for Health, Dr. Bernard Okoboy, Chief Director, Ministry of Health, Alhaji Afeez Adams, the Director General of the Ghana Health Service, Dr. Patrick Kumaboj Abuaji, the Acting CEO of Korle Teaching Hospital, Dr. Usu Sechere, the CEO of Lightwave eHealth Solutions, my brother Mr. Sapson Jabba, directors of Korle Teaching Hospital, development partners, our incoming Member of Parliament for Ablekuma South, Honorable Teacher Ago, hard-working healthcare staff here, Nime, Name, friends from the media, distinguished ladies and gentlemen, good afternoon. I am honored for this opportunity to join you as special guest of honor on this historic day, and it is a historic day, to commission the National eHealth project today. I've been looking forward to this day, and I'm grateful to God for bringing us this far. Ladies and gentlemen, the fourth industrial revolution has propelled significant technological advancements that have reshaped societies, including their healthcare service delivery systems, and so on. However, most developing countries, Ghana included, have in the past not been able to adequately harness the opportunities this digital revolution presents. This narrative is, however, changing under the MPP government's digitalization agenda, which I have been championing over the past 8 years. Through the government's resolve to change this narrative, I have spearheaded several initiatives aimed at leveraging digital technologies to enhance governance, service delivery, revenue mobilization, tackle corruption, and enhance financial inclusion and innovation in Ghana. Notable among some of these initiatives I've championed include the Ghana Card, the Digital Address System, and the Ghana Post GPS and mobile money interoperability. Additionally, I've championed the Universal QR Code Payment System, the Paperless Support System, and the Ghana.gov e-services project. In the health sector, I've championed initiatives such as the Ghana Card at Birth project, the National e-Pharmacy platform, the digital renewal for the National Health Insurance subscribers, the Zipline drone-based medical delivery project, and the Lightwave Health Information Management System of the National e-Health project, which we are commissioning today. And these have revolutionized various sectors of the Ghanaian economy. Distinguished ladies and gentlemen, I am very, very happy today. This is really a great day for Ghana. As you have heard, we confronted a major problem of lack of accessibility by the medical practitioners to data and to timely data on patients. You have the missing folder problem that Dr. Okuboy talked about, and you saw the state in which the folders were being kept, how dark some of the places were and how difficult it was to retrieve some of these folders. And you could go to the hospital and you'll be told your folder was missing and they couldn't find it. And you had this problem, and you had also a problem of a lack of networking of the hospitals. And these were the problems we had to attack and settle and resolve, amongst others. So ladies and gentlemen, I'm very excited by this LIMS initiative because an integrated electronic medical record system is crucial for a country's healthcare infrastructure. Electronic health records, such as LIMS, consolidate patient information across healthcare providers, enabling a more coordinated, efficient, and safe approach to patient care. Deployment of the LIMS application as part of the National e-Health project over the last 6 years has been instrumental in delivering efficient and effective healthcare in the country, improving health processes and infrastructure across public health facilities. Ladies and gentlemen, in 2017, the MPP government, through the Ministry of Health, engaged Lightwave eHealth Solutions Limited to pilot the National eHealth project as part of the National Digitalization Agenda in the Central Region. Following a successful pilot of the project in 2018, approval was given for the commencement of Phase 2 in 2019. This phase, which is currently ongoing, has seen the deployment of the LIMS in about 481 health facilities, made up of all teaching, regional, district, polyclinics, and psychiatric hospitals across all the 16 regions, and we are ongoing at health centers. This means that currently all the bigger health facilities in Ghana, which are the 6 teaching hospitals, 10 regional hospitals, 243 hospitals, 3 psychiatric hospitals, and 50 polyclinics are all deployed with LIMS, with over 1,000 health centers deployment currently ongoing at the moment. This is really massive when you think about it. So today, as you were told, if they refer you from Wa or Joaboso to Kolebu, you don't need a folder. You just need your ID number. And when you get to Kolebu and you meet Dr. Usu Sechere, he puts it in the number in the system, all your medical records will appear, whether you are from Joaboso or Wa or Tamale. That is very, very good for healthcare in Ghana. Ladies and gentlemen, the impact of this project on health service delivery has been tremendous so far, as you have seen from this. Prior to the deployment of LIMS, there were challenges with easy and timely access to patients' health records, portability of patient records from service point to service point, legacy silo systems, inability to track and process revenue, manual process for NHIS claim submission, and limited data for decision making at the various levels of health administration. Ladies and gentlemen, the days where patient records and case history existed in silos are no longer with us. Because of the introduction of the LIMS application, this has facilitated patient record portability to any LIMS site, which assures continuation of care without the patient having to maintain and transport his or her folder across different health facilities. It's also eliminated paper patient folders, elimination of folder container and storage space costs, availability of real-time data at the point of care, improve revenue accuracy. You've seen some of the hospitals are saying that, their internally generated funds, in fact, tripled or doubled as a result of this system. You have also easy and accurate submission of NHIS claims, and this system really reduces fraud in NHIS claims because the whole system is networked and you can track the movement from hospital or department to department. Hospitals and health centers running LIMS have reported average improvement of revenue of about 30%, with a 35 to 40% improvement in patient wait times, whilst regional and teaching hospitals are reporting over 40% improvement in wait times. Ladies and gentlemen, the deployment of LIMS has improved access to actionable epidemic information in a timely manner. And you know how devastating an epidemic can be to the economy. It can be really, as we saw with COVID, it can be totally devastating. And so the key is timely information so that action can be undertaken. The purpose of real-time surveillance is to advance the safety, security, and resilience of the nation by leading an integrated biosurveillance effort that facilitates early warning and situational awareness of biological events. LIMS has demonstrated that it is capable of tracking and alerting symptom sets of data in real time to the disease surveillance team. The impact on reaction times for controlling disease outbreaks is enormous. Enacting response measures such as quarantine and isolation protocols changed from days or weeks to minutes or hours. Here it is worth noting that savings from early detection of disease outbreaks has the potential to decrease the medication budget of Ghana. This model can be expanded to other diseases so that medication budgets can be better and purchases of medication made at lower prices. As we are all aware, drugs and pharmaceuticals constitute about 40% of the total health budget, and drug sales make up 50% of the health revenue. Cost containment measures supported by the project has improved efficient management of total drug inventory. Ladies and gentlemen, the LIMS solution allows for real-time validation of a patient's NHIS insurance status, confirming a patient's coverage eligibility at the time of registration saves time and money by eliminating claims from uncovered patient visits. LIMS builds the NHIS claim at each point of service during a patient's visit. This means the claim is prepared when the patient encounter is completed. All completed claims are ready for review and submission based on facility process. This has greatly improved filing time and accuracy. In fact, NHIS reported nearly a 30% cost savings due to improvements in accuracy and timely filing at sites running the LIMS software. Yes, you can clap for them. Because the LIMS application checks the claims rules at each point of service, inaccuracies are being detected immediately. The end results are only claims that meet NHIS standards can be completed, reducing fraudulent claims. At this point in time, across the hospitals where the e-health project has already been deployed, healthcare administrators can track some core parameters such as the availability of beds, nearest access to specific tests and medical services, availability of specialists, and load on inpatient and emergency wards. A real-time dashboard with these parameters being tracked along with 40 other useful parameters for public health teams is already deployed for use. Ladies and gentlemen, the National e-Health Project has been deployed as a holistic healthcare platform. Real-time data collection from connected LIMS facilities has provided health stakeholders and disease control experts a unique opportunity to enable health policy decisions for the entire health continuum in a manner never envisioned before. Ladies and gentlemen, as security and reliability are critical for any mature EMR application, the LIMS application has been developed on 3 pillars of security, reliability, and availability. So all electronic medical records have to be built, around security, reliability, and availability. It is encrypted, shadow copied on multiple secured servers, locally available at facilities, so internet downtime and unavailability do not cause problems with patient care. LIMS is also capable of maintaining the provision of care remotely using real-time backed up data in event of a local failure. This bidirectional feature of the LIMS system provided the greatest opportunity for a successful patient outcome. Again, the rollout of the LIMS application has become the main backbone for integration of all other services and operations at health facilities deployed on the LIMS. On-site banks across these facilities have been successfully integrated with LIMS to facilitate cash payments, reduce wait times at cash counters, and improve visibility of funds at the hospitals. Diagnostic equipment such as analyzers are all integrated at the various health facilities with the LIMS to ensure end-to-end data flow for decision making. Ladies and gentlemen, one initiative I launched last year is the issuance of Ghana card number at birth, which is integrated with the LIMS application as the main patient health record system for capturing of baby and parents' details at the various hospitals. And so under the Ghana card at birth, when the child goes for weigh-in At that time, the child is able to be given at the point of weigh-in a Ghana card ID and a birth certificate ID at the same time. So that was a major reform that we brought in. The National Electronic Pharmacy platform, which I also launched in 2022, which seeks to ensure a safe and secure access to medications and pharmaceutical services in the country, is also integrated with the LIMS for drugs data at the various facilities to ensure continuum of care. One of the big advantages of what we have done with LIMS is that it really provides us a very solid foundation for telemedicine in this country. And so you're seeing NHIS beginning to put in place the telemedicine architecture for this country. And it's going to save the health service a lot of money and free up time, because there are a lot of patients who don't really physically need to go and see a doctor. And they could see the doctor from home remotely and leave more patients who need to see doctors personally the space to do so, and it will unclog the waiting time. So I think the telemedicine and the future of telemedicine really is upon us with the LIMS that has been now done. In fact, I at this point want to specially thank and congratulate the CEO of LifeWave E Healthcare Solutions, Mr. Samson Jaba. Please take a bow. This man is a bit special. He's a bit special. He's brilliant. He's brought his knowledge, which is global. He's a global player. He's brought his knowledge to help this country. And I am so proud of him for what he's doing globally and what he has helped us do in Ghana. I think that he deserves a round of applause. The LightWave team, they really deserve a round of applause, because a lot of the time we just see the end product and we are not concerned about how it came about. But a lot of sleepless nights, many sleepless nights. I've been on the phone several times with Mr. Jaba at various times as we move this project through to get it done. But they have been very professional and very patriotic. They wanted Ghana to achieve what we have achieved today, and I want to thank him and everybody. I want to thank all the other players, the Ministry of Health, the Ghana Health Service, the health facilities that have all participated in this. It's been a collective effort, and I'm really proud as a Ghanaian with what we have done. Not many countries on the continent have done or have been able to do what we have done. And I really am looking forward to us leveraging all of this health solutions to do greater things for Ghana. Ghana is moving to bigger things. On Friday, I want to note that Ghana will launch 5G on Friday. 5G. We are moving to 5G, which is a major, really major undertaking for our country. And 5G changes so much for the digitalization agenda, because the speed of 5G is 100 times the speed of 4G. 100 times. So faster downloads, faster uploads. And you look at 5G and it has 1,000 times more capacity than 4G. So it's got capacity for hundreds of thousands of devices working seamlessly and communicating. It is set to transform sectors like the health sector, 5G, and what we are doing. This is really going to be helped. I mean, what we have done with e-health is going to be really helped with 5G. Health wearables, for example, are able to reliably transmit data in real time to medical professionals. And so you will be able to get into a situation where you can transmit data from yourself to your doctor, and he'll be able to say, look, maybe you're about to have a heart attack, and we better get you into the hospital. While sitting, you are thousands of miles away. So we are in a whole new era with 5G coming in. So we're going to continue building on this. At this point, ladies and gentlemen, permit me to acknowledge all of those who have helped to make this possible. And I wish to take this opportunity to commend the Honorable Minister for Health, Dr. Bernard Okuboy, and his predecessor, Dr. Kweku Ajimaminu, who was working very hard on this project, as well as the Ministry of Health and the Ghana Health Service for successfully organizing this event along with Lightwave, and to look forward to the completion of deployment at the health centers and the CHIPS compounds and private facilities to facilitate better patient outcomes and healthcare delivery across the country. I believe Ghana has reached a major milestone today, and I keep saying it is possible. Thank you very much. Thank you for your attention. God bless you.
So have Your Excellency taking a group photograph. After that, we'll say bye-bye to us. Thank you.
Good afternoon.